now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Hi, folks. We continue our health journey here in the Lehigh Valley Health Network. We are telling you a lot of great things that are happening in the network. And we try to keep you informed. For those people who come up to me saying we like your show, we keep you informed. That's what my job is, folks. Today, no stranger to the show, Sam Lesante Show, Dr. Jim Caggiano is here. Caggiano, right? Yes, I said it right?
You did.
All right, just like the Italian name, Caggiano. Well, last time when you were on the show, we talked about, what was it, the coughs?
Whooping cough,
Whooping
yeah.
cough. And is that a seasonal thing, or is that something that comes and goes?
Whooping cough is somewhat seasonal. The important thing is that it's an immunization preventable disease, and the big worry we have is that these days is that the kids who are most at risk for that disease are the ones who are too young to be immunized. So a lot about what we talked about last time was getting parents and grandparents who are going to take care of these kids immunized against whooping cough, so that there weren't any people bringing the whooping cough to these kids.
Is that contagious?
Very.
Now, okay, so if there's always a concern with parents with their children, okay? I know we're going to be talking about asthma today, but when your child comes home and says, you know, oh, what's her name, sick, and there's an outbreak. There was an outbreak recently in our area of, I forget what it was.
There was norovirus,
yeah. So is it best to keep your kid home, or what do you do?
You're always going to be walking a fine line with that. I mean, my attitude is that we shouldn't sequester our kids. We should get them out and doing what they need to do, but we need to teach them how to take precautions. Like before they eat, they need to wash their hands, and after they go to the bathroom, they need to wash their hands, and they need to learn habits where they're not always rubbing their noses and touching their face and that sort of stuff, because a lot of these things are passed from your nasal passages onto your hands. So I think that if we kind of teach kids good habits as they're getting older, they're going to be less likely to catch everything that comes down the pike. You
know, sometimes I wish parents would have their kids be kids, okay?
Well, that's important.
Yeah, other than always because sometimes I think parents put a lot of pressure on children to do certain things just for themselves. I don't mean to be a wise guy, but I mean, and what happens is that the child is under a lot of stress to do this, to do that, to do this, to do this. And what happens is I think it takes its toll on a child, whether it's health care, whether it's not getting your proper rest, whether you're not having a proper meal, a balanced diet, because the kid is then the kid goes to school and you better do good and you better get your A's and you better do this, and how come and this poor kid's shaking like this? I don't know, maybe I'm going to extremes. Am I on the right track here or on?
I mean, I think that it all comes back down to that as parents we all make choices about what we think are the most important activities that our kids should be engaged in, and what our priorities are for their care and their recreation and their education. So, I think that you have to not do things helter-skelter. You need to think about, well, what do you think is really important for your kid? And I'm not a big fan of kids being, as you suggest, overscheduled, where, okay, you have to be doing this at this point, and then a little bit later, well, now it's time for you to be doing this. I think that spontaneity in childhood is a real important thing.
Let them go out and play. Let them play with their friends. I mean, I understand that there's certain talents in sports that you should be involved with, and I think that's good, okay? But I think what's happening sometimes is parents get involved and they take it out on their kids because it's something that they didn't do. I don't know. Maybe I'm crazy, but I see sometimes where children are under a lot of stress and because they don't get their proper rest and because they're stressed, things happen. Now how I know when an adult is stressed. There's things that happen. They could either, gain weight. They could drink. They could do a lot of things. Okay. Well, don't you think the kids are in the same situation? Not that they're going to drink, but under some kind of stress that things happen to them.
Well, that's very, very true. And kids manifest stress in some ways that are similar to adults, and in other ways they manifest stress in ways that don't resemble adult behavior at all. The underlying concept, I think, is that kids react to stress in ways that are developmentally appropriate to them. So, for example, with a 2-year-old, if you've got a kid who's pretty agreeable and pretty much does what you ask and is, eating really well and playing and enjoying himself, who suddenly becomes withdrawn, doesn't want to eat, says no more than yes. I mean, now there are kids whose first word is no and it's their favorite word and that stays their favorite word until they're 20. But if you've got a kid who's not that way and suddenly becomes that way, you need to be thinking as a parent, okay, what's different? What should I be looking at? Are there other things going on? And that goes for everything from, I'm not getting my nap when I need to because mom's letting me call the shots and I really don't have enough wisdom or maturity to know that, I really do need this nap, all the way up to the far extreme of things like, behavior that's off can be a sign of something a whole lot more sinister. I mean, when they teach pediatricians and family doctors to recognize abuse in children, that kind of change in behavior can be an early subtle sign. That doesn't mean that every misbehaving kid is being abused, but it means that you have to think about a wide variety of things as being possibly causative in that situation. That's all. You have to keep your eyes open.
Jim, it's tough being a parent sometimes today. I mean,
it's the toughest job that you're never trained for.
Yeah, and and with all due respect, I know parents. Both parents have to work sometimes, and you don't have the luxuries that we had when we were growing up, sitting have dinner with every night with your parents or your family, where you had the family discussions, and those things happen. But I think if you get proper rest, proper balanced diet, okay, not that you're not going to get a cold or something like that, but I think you're in a better situation than you were if you had stress and you cannot get your rest and you're on a time schedule,
Yeah, that's true. Another sort of inverted part of that is that we see lots of parents who try their best to be absolutely meticulous about their hygiene with the kid, and they wonder, why is the kid always sick? And then we see lots and lots of kids whose, there's a lot of kids in the family, they don't have the financial wherewithal, they're kind of a little bit not so clean around the edges and all that sort of stuff, and they don't get anything.
I know.
They're fine.
I know, that's my mother used to say.
I mean, there's a whole scientific thing called the cleanliness hypothesis that it's a good thing, for example, to get kids exposed to things like pets early on because it kind of revs up their immune systems. And there were studies done that show that exposure to, for example, a family pet can actually protect you from by decreasing your risk of asthma. Okay, there's your segue.
Okay, thank you very much. That we're talking about. Hey, see, we're gonna become a team here, Jim. I like this. All right, so we're talking about that's the key
we're
thing.
Abbott and
But
Costello.
I just want to say one thing. When in parties, when I grew up in parties, when all the kids are out, we're outside in the rain, in the mud, in the cold. We were playing baseball. Said who comes in the snipples? Thank the good Lord. But all those people who were trim and make sure they had this, that they were
live
sick.
to be 90 and they're fine.
All right, what are some of the common symptoms seen in a child who might have asthma?
The thing that we see most commonly is cough and difficulty breathing. Most kids, if they're old enough to tell you, will tell you that their chest feels tight. They notice that, when I breathe, I'm not breathing with the same ease, although certainly a kid wouldn't use that word. In younger kids, sometimes it's just a dry cough that when they try to run around, it makes them stop. So if you see that your child is pausing and sort of runs out of breath before his or her peers do, that's something to think about. Asthma is something to think about.
So, okay, if you see these symptoms, okay, so in our area, okay, how prominent is this?
In our area, asthma is very, very common. And
why is that?
well, the thing is that we talk about asthma as though it were one thing, and actually the kind of final common denominator, what kind of looks like asthma to the outside, can be triggered by a bunch of different things. The largest proportion of kids who are older have asthma on the basis of being exposed to certain things that we call triggers. These are the things that when this kid is exposed to this, that, or the other thing, specifically in the environment, they're more likely to wheeze and have the cough. So, for example, if a kid is allergic to grandmom's cat, the kid may run around and be perfectly fine until he goes to visit grandmom, and when he comes home, he's got this cough that won't quit. Some kids are the biggest preventable cause or contributing cause to asthma is plain old environmental pollution. So cigarette smoke is a killer for the parent, but it's a killer for the kid too. So some kids have wheezing in response to exercise. So as kids move from just spontaneous playing as kids to more vigorous exercise in a more structured setting, or as they get older, sometimes that will make them wheeze. And what's true about triggers, Sam, is that if two separate things bother you, if you get exposed to the two of them at the same time, you're going to be worse off than you would be were you exposed to one or the otother separately.
Staying on the subject of smoke, okay? Yeah. I don't know how many households or homes or whatever you want to, wherever they live, where people smoke in the house, where there's little babies and kids. If they only knew the damage that they're causing. Am I correct? Because some people say...
Well, I think... I'm a pediatrician, so I'm ultimately going to be an advocate for the kid who doesn't have any say over what happens in his environment. The flip side is that tobacco use is an addiction. If it were the easiest thing to quit, nobody would smoke. It's kind of like being fat. If it was easy to be thin, there wouldn't be any of us fatties around.
Smoke outside or have a designated place.
Well, okay. And a lot of people make a really good effort with that. I have to tell you that a long time ago, I was tagging along at a children's lung clinic down in Hershey. I was following the professor there, Stu Warren, wonderful pediatrician, and we went in to interview a family whose child had been diagnosed with asthma, and they wanted their family doctor wanted a second opinion from Dr. Warren, and Dr. Warren, of course, took a very detailed smoking history. Well, as soon as we walked into the room, there was an odor of smoke about the exam room, and Dr. Warren asked the dad, well, do you smoke around the kids? And he said, well, no, I smoke outside. And he said, well, he said half kiddingly, you better do it naked because, you're bringing it in with you. Yeah. I mean, it's kind of like when you come home and you work in a hazardous environment, what do you do before you get in the door? You shed all that stuff so you don't bring it into the house. And this is the same kind of thing. Is that a tall order? Yeah, and I'm sure that a lot of people would say to me,
being kind now,
you're not a smoker, so you don't understand what it's like to do that. And all I'm saying is that if it has to do with how well your kid's going to do in the long run, then you do what you have to do.
I don't think there's any excuse at all to be smoking around a baby or any child. This is my opinion. You don't have to agree with it. If you're in a car and you're smoking, you have children in the back, or if you're in your home and you have children in your home, babies or whatever, I think you're doing them an injustice by smoking in that house, okay? Well, and I know they're going to say, I'll do whatever I want to do, but that child doesn't have a say. That little baby doesn't have a say.
And I think that it's our job as people who offer guidance to parents to be upfront about that stuff. There's no sense dancing around it. You have to say, listen, this is the way it is. I'm just trying in some small way to say to the smokers out there, look, I know that this isn't a piece of cake either, and it's easy for me to say, but the stakes couldn't be any higher.
That's right. Now, getting back to asthma, okay, because, smoking, what kind of diagnostic testing is available to determine if your child has asthma?
The diagnostic tests that are usually used are what are called pulmonary function tests, and pulmonary function just means we're testing how the lungs work. The problem with doing pulmonary function tests, and we do them in our office and in physicians' offices where they can't do them, they're readily available in the hospital. They really require the cooperation of the child, and so they really need to be over about age 4 before they can do that. Now, there are other tests where the child doesn't have to cooperate. And so children's lung specialists, like our colleagues down at Lehigh Valley and other places, can do breathing tests that don't require the youngster's cooperation. They could do an exhaled nitric oxide test, which will allow us to determine what's going on with the youngster in a younger case. In older kids, we can challenge them to inhale a substance called methylcholine, which can actually trigger an asthma attack. So then you can say, okay, we've triggered it, now we're going to give you the medicine to undo it, because built into the definition, part of what's built into it is reversibility. So when you get this, if it's asthma, you ought to be able to reverse it.
Folks, if you just tuned in, I'm talking to Dr. Jim Caggiano from the AMG Pediatrics. That used to be the Destin Center on the Beltway, the airport Beltway. His number is 570-501-6400. Of course, they're now part of the Lehigh Valley Health Network, and their slogan is a passion for better medicine. And believe me, folks, the bar has been lifted tremendously here, and we're talking about asthma, among other things. I have a tangent going on some other things. Would you agree, Jim?
Important stuff to talk about,
yeah.
though.
All right. Now, we talk about diagnosing and the children, so you find out there's asthma there. Okay. What are the treatment options available to treat this child with asthma?
Okay. So, asthma, by definition, is reversible airway disease. It's spasm. The muscles that are wrapped around the breathing passages go into spasm. They tighten, so the breathing passages are compressed from the outside. Simultaneous with that, the lining membrane of the lungs gets swollen, and the mucus-producing cells inside the breathing passages go into overdrive. So it's not just that these breathing passages are in spasm, they're being compressed from the outside, but they're also swelling from the inside. And I say that because the way we treat this is built on targeting those three mechanisms. So when we give a youngster, for example, inhaled albuterol, which is the commonest medication that's used, the youngster's spasm in the breathing passages will relax, but albuterol doesn't do anything for the swelling on the inside, and it doesn't do anything for the buildup of mucus inside the lining of the breathing passages. For that, you need anti-inflammatory medicine. So when we treat asthma, we take a combination approach. We want to go ahead and first of all, eliminate exposure to triggers as much as we can, because the more asthma you can prevent, the less medication you're going to need to use. Second thing is we want to promote their getting outside and getting plenty of exercise, because that's going to make this less of a problem. But then when we're talking about medications, stuff that you go to the drugstore for, we talk about medications that are called rescue inhalers, like albuterol, that work immediately and get the spasm to go away. But then we talk about anti-inflammatory medicines, medicines with very, very commonly known names, budesonide and those kinds of things. I don't use brand names. If I don't have to, that's not appropriate. But those kinds of things are used as so-called controller medicines, and over the long haul, they will diminish the amount of inflammation in the youngster's lungs and therefore make them more resistant to having attacks in the first place.
All right, so going from the beginning, my child's coughing a lot, you detect there's something wrong, okay, come to Dr. Caggiano and up at the AMG Pediatrics, and you diagnose the child with asthma. And now I'm nervous. The parent is a nervous wreck. I'm scared, because, oh my God, what are some of my fears, and how do you address these fears so I don't kill myself?
Well, part of the problem, of course, is that this starts at some point in time, and by definition, asthma is a reoccurring thing. It's not like,
does it ever go away?
If these kids are managed carefully with a lot of cooperation from the parents, a lot of them outgrow it. And that's the goal of what we're trying to achieve. We are trying to keep these kids' lungs from being inflamed as much as we possibly can, so that then as they get older and grow new lung tissue, because that's the great thing about kids, everything's getting bigger and being renewed and all that stuff as they get older. So if you can keep their lungs from being recurrently and consistently inflamed as they get older, and very typically as they go through puberty, the asthma seems to go away. Now, if you stress them hard enough, if one of those kids who now is 20 decides to pick up smoking, he's going to get his asthma symptoms back. Or if one of those kids who was an asthmatic as a kid gets a bad pneumonia, in addition to having the cough and the chest pain that you or I might get as non-asthmatics, he's going to have symptoms of his asthma as well. So they, quote, outgrow it, but if you push them hard enough, it's still in there.
Well, so hence, soon as you feel that if your child is coughing or you sense something different, it's best to get them diagnosed or go to the pediatrician.
Well, it's important for a couple of reasons, because the first time it happens, people, and you'll say to a common question that I get asked is, so doc, is this asthma? You're treating him with asthma medicine. And the answer is, I don't know. Asthma comes back. And one of the things, we talk about allergies and other environmental exposures causing asthma. The younger the child is, the more likely the asthma may be related to an exposure to a viral illness, like respiratory syncytial virus. And what happens to those kids is, a lot of them don't have any family history of asthma. It's not inherited like it is in the vast majority of kids. And so the question is always, well, okay, I had to treat this like a little asthmatic. Is this going to be a problem? And so I tell the parents is, look, you know, the next time he gets a cold, if it seems like it settles right in his chest, that's a warning sign. And parents will say to me, well, okay, you gave me this machine to have this kid breathe this medicine. When do I use it the next time? And the answer is, if he gets a cough and you're not sure whether it's asthma or not, give him a treatment. Mm-hmm. Giving him one treatment's not going to cause any significant harm. May make his heart beat a little bit quicker. But if it makes a difference, if he's better, that's a hint that this may be asthma, and that's why your point of getting it attended to early means that the point where somebody says, wait a minute, this has been happening and reoccurring, occurs earlier in the course if they get involved with the doctor earlier, rather than if they say, oh yeah, you know, he seemed a little bit droopy and coughed for 3 or 4 days, but then it went away, so I didn't have to do anything about it, so I didn't. And as parents, you know, we're always kind of trying to decide, well, when do I push the button? Is it time to do it now? Is it time? And you know, I want people to be comfortable in their own skin and to develop their own sort of sense of comfort in dealing with things. But at the end of the day, if you don't understand what's going on, that's what you have a doctor for. So pick up the phone.
Well, this is what I'm trying to say is that is if you get this, if you notice something is not right with your kid, they're coughing. First of all, that child should have been going for examinations anyway, physical examinations. And you start them young, right, as a pediatrician doctor. So I'm taking my child for exam, which incidentally, if I'm taking my child for a physical exam, can you determine whether that child has asthma as a normal physical exam?
The problem is that that's the frustrating thing about disease states like asthma. In between times, these kids may be totally asymptomatic. If your kid is a kid who only gets chest tightness and wheezing when he has a respiratory tract infection, you may take him to the doctor's office and the physical exam doesn't show anything at all, and that's when we get into referral to specialists and doing diagnostic tests and all that sort of stuff. But the most important instrument a doctor has is his ears and his ability and willingness to listen to what the patient's saying to him. If the mom says to me, gee, this kid's had this troubling cough that's interfered with his sleep 3 times this winter, and it's only November, ding, 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 there's something going on. It may not be asthma, but it's something that bears attention. Mm-hmm. Well, so sometimes you'll look and you'll say, can you pick it up on the physical exam? The answer is, no, not necessarily. But if I listen to what you're telling me and I give you a chance for you to tell me what you think is important as a parent, I should get the message that this is a problem and begin to address it.
This may be a dumb question because I've been known to ask a lot of dumb questions.
Dumb ones are the ones you don't have answers to, Sam. You should know that.
I know. But is there any average age, okay, that you find? Is it between 2 and 4, 4 and 6?
I think that asthmatics fall out in a couple of different age periods. The kids who are getting asthma-like symptoms, who have reactive airway disease, we call it, because of exposure to viral infections, show us that very early, and it tends to happen in the wintertime because that's when those viruses are around. So I can't tell you that oh, it's more common in 3-month-olds or 8-month-olds. It depends on when the kid went through his winter. That's when it's going to happen, because RSV is a virus that commonly does this. Okay, we also see it in allergic kids right around the time they're getting ready to start to go to school.
So mostly seasonal is when it spikes.
You see seasonal spikes because of exposure to viral illnesses. You also see seasonal spikes, for example, we're going to start being up to our eyeballs in kids with allergies and asthma as the weather finally breaks free and gets warm, because kids are going to be inhaling all kinds of things that they're allergic to, and that'll trigger stuff too.
Okay, so now here's the other factor. Parents, a child is active in sports. Okay, and you diagnose them, Dr. Caggiano, take the doctor in, he's been coughing, and you diagnose the child as asthma. I'm a nervous wreck, he can't play football, he can't play baseball, he can't, play basketball or whatever the case. Can I play sports, can I not? What's the story?
Absolutely. Our criteria,
Absolutely what?
that they can play.
Okay.
Our criterion for success in treatment is we want our asthmatics to be indistinguishable from any other kid on the playing field. Now, there are some sports that are better for kids who have asthma.
Chess, checkers.
No. Physical stuff. Kids who have asthma do better in short burst sports. They do better in warm, moist environments. So swimming's a good idea. If I was going to tell an asthmatic who wanted to run, I'd say, pick up the 50-yard dash. May not do as well in a distance run. However, conditioning can change all of that. So if the youngster says, listen, but I really want to do this, I really want to run the long stuff, then you say, okay, then we're going to have to just do everything we can to gradually build up your lung capacity by increasing your conditioning. And yeah, you should be able to do what you need to do in that sport. So we want these kids, one of our objectives in all of this with any illness is to make that kid feel normal.
So the rule of thumb is, if your child is coughing or senses a little test, get him in for, get him in to see Dr. Caggiano.
Especially if there's a family history.
Okay,
Yeah.
Exactly. And at that point in time, you can diagnose if it's asthma, treat them accordingly, and they can live a normal life, okay?
Right.
And quit smoking. Dr. Caggiano was with the AMG group, that's the Alliance Medical Group Pediatrics, and it used to be the Edison Center. And it's up there. His phone number is 570-501-6400. Purpose of this show, folks, is to bring information to you so you can stay healthy. Excuse me, and that's what the Lehigh Valley Health Network is doing. I may have to come and see you myself with my cough. Well, doctor, I got to tell you, I have a minute left, and I want to tell you that, I think the doctors and everyone who's involved here with Lehigh Valley Health Network is excited about this merger. I think there's a lot of great things happening, correct?
Yep, absolutely.
Yeah. Well, Dr. Caggiano, it's always a pleasure to see you. How's your daughter?
She's doing fine, thank you.
I was asking about her.
I will, I always do.
570-501-6400. Folks, there is absolutely no reason to go out of town for health care. We have the best in our area. We'll see you next time.